Well, since it's a Friday, we're coming to the end of another great week on Inside Brant. We got the folks back from the SPCA yesterday. Got to meet a great dog who wasn't too fond of cats and a gorgeous little kitten. Now we're pleased to welcome back once again the man who helps to keep them healthy from Fairview Drive Pet Hospital. Dr. Thomas Mulder is here with some great advice. Welcome back.
Thank you.
You know, it's funny when we think about pets, think about pet health. I guess a lot of people don't think about things like insurance, and I guess if something happens to their pet and they're presented with, well, this is what you have to do, a lot of pet owners don't think in terms of a second opinion when these things happen.
Yes, both of those things are very important, the financial aspect as well as the second opinion. Medicine is like medicine in humans, and there's a lot of variability. I received a phone call this week of someone who had been given a poor prognosis, and she was quite distressed and didn't know how she could afford it, and never occurred to her until a friend had told her to call around, and we had a very interesting conversation with her.
But you can't get into, I'm going to go off topic a little bit, you can't get into telling them what to do, because I've been in that situation. We were presented with a prognosis on a 10-year-old dog that if we did this and spent all this money, the difference would have been maybe a month or two in life expectancy. Mm-hmm. And I guess all you can do is kind of say, you know, here are the options, and you know, if you need to talk to somebody else, that's fine.
Yes, indeed. I think the biggest thing is that we can't make a diagnosis over the telephone wire. I mean, we can see pictures, we can hear what's going on, but there's nothing like touching and feeling the pet and figuring out exactly what's going on. But we can make recommendations in general terms so that they know what to expect when they do come in, from both financial and from a prognosis point of view as well.
And you had your 13-year-old pet here last week who blew everybody away, because this doesn't look like a 13-year-old pet. Granted, you're a veterinarian. Now, it doesn't mean that everybody else can't have that same situation. I guess we're talking a lot of these things. I guess one of the points we want to make out is we want to talk about pet health and preventative care.
Yes. Good thing you mentioned my dog. I mean, I love my dog Bella, of course. But it's interesting, I had her sister for a time and then found a home for her sister, and she was switched to just a regular dog food shortly after she was adopted from us. And her owners came in to visit about a month or two later, and she couldn't believe the difference between the two dogs, even after 6 weeks of a different food. Nutrition plays such a big role, and I credit that for Bella's longevity and her overall health.
Yeah, what's the nutrients we're talking about here for a dog? We know for a human being you got to get the the milk and the bones and all these kind of things. What is or isn't in a food that's going to affect, maybe I'm putting you on the spot, a dog's health?
No, this is one of my pet peeves. I love to talk about pet nutrition. We could spend your whole show on that. But the most important thing is the quality of the nutrients that are in there and the total amount of those nutrients. I have a saying I like to use, that the serving size has to satisfy, and then once that satisfaction is achieved, all the nutrients that the pet needs have to be there. So a dog may need between 3 and 5 grams of protein for every kilogram of their body weight, but if they're only eating a cup of food, that food's got to have an awful lot of protein in it to get that amount of food protein in there.
And as a human, fast food tastes really great, and I guess some of this less nutritious food tastes really great. We used to see those commercials talk about byproducts and fillers. Is that what the pet's getting that really is of no use to them?
Big topic there. Byproducts are byproducts of human food preparation, and not necessarily poor quality, but fillers in terms of the starches that may be just thrown in there. Yeah, certainly that's not going to contribute to the pet's overall health. But the big thing is you have to have a pet food that your dog likes, and it has to contain all the nutrients that your pet needs. And then the third factor is to consider the health aspects. This woman who called, dog was experiencing bladder stones, and depending on the diet used, we may be able to prevent some of those in the future. And in her case, hopefully, good nutrition would make a big difference for her.
You got a great article in the paper this week talking about the cost of what's going on. Does good food have to bankrupt me?
I have found recently that in the last, say, 2 years, that the highest quality food that I can offer through a veterinary office is often very much comparable to what's a premium food in a pet store. So no, it doesn't have to. It's more getting the right fit for the right need. And
you can get those giant bags. I've been in pet stores, where they welcome your pet these days. And you can get them where, they're going to have food for a whole ton. Listen, I hope you come back and see us again real soon. Who knows, maybe we'll do that whole show.
Oh, I'd love it.
Dr. Thomas Mulder, thanks for the time once again. For Fairview Drive Pet Hospital, keeping the four-legged friends healthy. We're going to come back in just a little bit of music, a little more information on the agriculture world as well. That's next right here on Inside Brant. Thanks for joining us before the weekend. We'll be right back.